So when should a couple come and visit the infertility specialist doctor, and
Yeah.
what should they expect before they come?
Yeah, so what we ideally we tell couples is, see, when they start planning for pregnancy, we tell them to at least plan for 1 year and see.
So 1 year is, one year is
1
normal
year is
range.
normally we tell them to take time, because not everybody conceives. See, today we see a lot of couples coming within 1 or 2 months of planning, and they tell that, yeah, we have some issue. No, give time, sufficient time of 1 year at least. But yeah, in patients with issues, like if the girl's age is more than 30-35 years, or she's known to have irregular cycles, she already knows she's got irregular cycles, she's had some surgeries in the past, or she already is a hypertensive, diabetic, she's got thyroid issue, any epilepsy. Now these girls need to visit us earlier. Why? Because one is the drugs they are taking probably may not be safe if she plans immediately, so that needs to be changed.
Yes.
And also if there is an issue, we can at least diagnose at what severity it is and whether she needs treatment or not. Yeah, as early as possible, so that the things can be sorted out earlier. Even in men, what I would suggest is if they have had a previous childhood surgeries, or any other problems they've had during their reproductive phase, like mumps or certain conditions which can actually decrease their chances of conception. So they can come down for a routine testing.
Okay.
Earlier, yeah.
As early as possible.
As early as possible.
The infertility
otherwise,
specialist.
they can take 6 months to 1 year time and come and visit the. So basically, today the primary is the gynecologist, but today since the issue of fertility has increased a lot, so today as a fertility specialist, I would say that if they are not conceiving within 2 to 3 months of a routine gynecologist consultation, it is best that they go meet the specialist in that field.
Oh, okay.